Hi, so this is David Raven again from the HECTOR project, Heartland's Elderly Care Trauma and Ongoing Recovery Programme. Hopefully by now you would have watched our previous videos where we're looking at eggs really as a analogy for older patients, whereby the non-boiled, non-cooked egg with the hard outer shell, the runny middle, represents the older patient, and the boiled egg, which is nice and soft, nice and firm, represents a younger patient. So this experiment is the head egg smash, which involves eggs and infants, and we're doing it to look at the emergency response to trauma and to elderly patients with injuries. So in terms of this experiment, what we're going to be doing is seeing how two young children respond to directions of smashing an egg against the other's head and seeing whether they're going to stand still or not. So we're going to go outside again and basically see what we can do. So Henry, you've got the hard-boiled egg. Okay, and as we said, you're going to go up to Finley, and what are you going to do?
Smash!
Go on. Well done, okay. Now, Finley, it's your turn. Henry. Okay, so that's enough, Finn. Stop. Okay, fine. So, essentially, you can see from that response from my youngest that we know that egg that's non-boiled, non-cooked, that's runny in the middle, that's got a hard outer shell. Stop! If you actually sort of were to take that against a sudden mechanism of injury, we expect that's going to go everywhere, that the yolk is going to run everywhere, that it's going to get really messy. But that's how kind of we should be thinking as emergency responders, really. So obviously I'm not saying everyone's eggs or whatever, but the whole idea behind this is to say that, you know, an elderly patient who's been involved in a high-speed RTC or who's fallen from a significant height, you know, our response should be a lot more elevated than a younger patient with the same mechanism. It should all be quite, you know, very on the ball, trauma team, you know, we need to do these investigations, we need to do these scans, we need to correct coagulopathy, all of these type of things. But there needs to be an extra step up for elderly patients, because if we're not doing that, then these patients who may be on warfarin, may have altered physiology, they're going to come a lot worse off. So, you know, we know that those patients are more vulnerable, yet we still use a one-size-fits-all approach. So, you know, the purpose of HECTOR is to say we need to take all of these things into consideration. We need to actually be addressing how we're delivering that acute care and how we're going to be changing our practice. So, hope you've enjoyed those videos. We'll try and do a few more, provided that we can clean up the mess. And thank you very much for watching, and thank you, kids. You still got the egg, haven't you?
Yeah.
Okay, bye-bye.